So, Steve Rolls, thank you so much for joining me for a Corona conversation, one of our first. And this is the second conversation you and I have had in the space of 15 minutes because the first one didn't record because I didn't press the button. But we're going to make this appear as spontaneous as possible, but at least we actually know what we're going to focus on. So, Steve, I want you to talk with your drug policy hat on, how current drug policies are compounding the difficulties and challenges that people who use drugs problematically have always faced. How are all those policies making things worse now?
Yeah, well, I mean, you know, as you allude to, the focus does need to be on the minority of people who use drugs, who do so in problematic or dependent or habitual or whatever language you want to use, where most of the public health challenges are focused. I mean, obviously, we can't just forget about all the other people. I mean, the majority of people who use drugs don't do so problematic. They do so fairly moderately and occasionally don't have significant problems. But we need to be, you know, alerting them to some of the risks associated with coronavirus as well. You know, sharing joints and sharing snorting tubes and preparing your surfaces and washing your hands and all that stuff. And there's been some good resources flying around about that, and Transform blogged about it last week, and as have a number of organisations like Release and Talking Drugs and Crew 2000 and Harm Reduction Coalition and others. So there's good resources there. But yeah, you're absolutely right. The vulnerable populations, particularly people who inject drugs and people who use drugs who are street homeless. We really do need to be focusing our attention there because of their enhanced vulnerability, both to being infected with COVID and in terms of their vulnerability to its effects. Okay. You know, many of them have underlying health problems, whether it's respiratory problems or heart problems or just sort of or hepatitis, and you know, they are going to be far more vulnerable to the effects of the virus than everyone else, and they're also more vulnerable to catching it. So if we don't take that seriously, not only are we, I think, sort of abandoning, you know, we have an ethical responsibility to the most vulnerable in society, but if we don't take that seriously, there will be a cost for them, obviously, which is, you know, potentially disastrous and tragic, but there will be a cost for all of society, because they will become another vector for transmission of the virus, system, and they will also become a burden on the health service as you know, as they get sick, probably more sick than many people in the general population. So we really do have to take it seriously, and there's various things underway to try and help alleviate or moderate some of the potentially disastrous impacts.
We want them to be as healthy as possible during this really difficult time. But in terms of current policies that compound their problems, I'm assuming the biggest one is getting caught with drugs and then possibly going to have to go to court or jail. So what should we be doing with that?
Yeah, I mean, all the arguments about not criminalising people who use drugs, which have been, you know, obviously rattling around for years, and you know, the World Health Organization has called decriminalisation of people who use drugs a critical enabler of public health interventions. It's very difficult to intervene with marginalised, stigmatised, vulnerable populations if you're trying to criminalise and punish them at the same time. It doesn't make sense on numerous grounds. On resource grounds, all your grounds are going to enforce, all your resources are going to enforcement instead of to public health. And critically, if you're criminalising the people you're trying to help, you're creating obstacles between them and the services that can help them, because they're going to be fearful of utilising and approaching those services because they're fearful of the criminal justice consequences. So there are clear reasons why we shouldn't be criminalising people who use drugs in situations of vulnerability, which are only intensified by this current crisis.
So your first thing now would be stop decriminalising people, but you want it more than de facto criminalisation. You want that to be something stated by law enforcement agencies to reduce the barriers for treatment seeking. You don't want it decrim on the quiet. You would say to governments at the moment, remove criminal sanctions for personal possession of drugs. We're not going to be arresting you. like focus on your health and well-being?
Yeah, I mean, I think this needs to happen quickly, and I think it's unlikely we're actually going to get a change in the law. But we're already, I mean, you know, you can talk to police now, and I hope maybe you'll get a chance to talk to some police in the course of these interviews. The police obviously have got other priorities at the moment. You know, a lot of police don't want to be arresting and criminalising people who use drugs anyway. They really are not going to be interested in doing that at the moment. They're not going to want to be you know, physically interacting with people who use drugs because it's going to put the you know, frontline police at risk of COVID transmission either way. And they're not going to want to be wasting their resources when they've got, you know, far more important priorities. You know, even in normal times, a lot of police don't think it's a sensible priority to be arresting people who use drugs. Now more than ever, it's going to be, it's negligent, I think, for them to be wasting their resources. And then, you know, given that courts and magistrates stuff have all been suspended anyway, how are they even going to process those people? Are they going to arrest them and take them down the station? No, they're not. So I think we're already seeing a move towards, you know, effective ending of criminalisation of people who use drugs, or dramatic reduction in enforcement. What I think would be key, as you've alluded to, is to actually have it stated publicly that you have a sort of de facto sort of statement that they will not be. It's the lowest possible policing priority. They won't be arresting people who use drugs. And I also think they need to be not to deprioritize drug supply as well. You know, because if they maintain pressure on drug supply at this time, it's potentially going to encourage the market to move towards more risky drug products and preparations. We're already hearing stories of some places where there's a drought, and where you have a drought, you'll tend to get increase in adulteration. We may see fentanyl and other synthetic opioids entering the heroin supply, so we could see a spike in overdose. So, you know, it would be good to reduce the intensity on drug supply side, even if it's only temporary, for the immediate future as well. Now, that's a harder thing for the government to announce, for the police to announce publicly, but certainly they could say we are not going to be prioritising drug supply. If you are a problematic drug user and you want to seek services, you can do so without fear. That would be very, very useful, and I think it's quite likely.
And the other possible benefit of taking the focus off people who are supplying drugs is it also gives people who are using drugs either with a script or with no script time to adapt. It gives them time to get into treatment, to get their methadone or buprenorphine dose up. Because if not, no, my worry is, as you said, possibly fentanyl comes in, or we see a displacement to prescription drug use. We see more diversion of prescription drug use. Then you've got people using multiple different sorts of CNS depressants, pregabalin, benzo, some heroin, and all of that just hugely exacerbates the problem. Or, and it's potentially the worst outcome, is you get huge displacement to alcohol. Which,
right, you know, or street benzos, or
you know,
things which, you know, or them in combination, even worse. So, I mean, I think there's the enforcement piece here in terms of the need to dramatically ramp down punitive enforcement against people who use drugs and drug supply at a street level. But there's also the service provision part of this, because there's going to be, it's likely that there will be a surge in demand for drug services. And there's different parts of that. There's access.
I love that.
There's going to be access, you know, a need for increased and lower threshold access to OST, clean harm reduction supplies, and naloxone, and there's also going to be a need for housing. You know, we can't leave these vulnerable people on the streets at this time, so we're going to need to find housing. And a lot of this stuff is going to have to be done in very clever, creative ways, because obviously the country is in lockdown. Services are starved of resources. It's a lot of staff are going to be going into isolation. It's going to be difficult. These are going to be difficult, challenging things, but if we don't deal with them, something far worse could potentially happen, and it may already be happening. So I think these are things that need to happen. They need to happen now.
And there are examples of kind of like city leaders stepping up and making a difference. So Sadiq Khan making those 500, hotel rooms available to homeless people. There is an opportunity to have a fundamental shift to looking after the most vulnerable in our society. It's a shame it takes something as harsh as this to make people, reconsider what they've always done. But that might be a positive.
I mean, I hope that through all this sort of horror that we're living through, and I fear is about to get unimaginably worse. I don't want to be the person saying that, but I really think in 2 weeks' time it's going to be. But we're heading into. I have a sort of sense of foreboding, like these clouds behind me, that things are going to get horribly worse in the next couple of weeks. But we have an opportunity to, hopefully some positive things can come out of this in terms of a sense of connectivity between society. People need to understand that, these groups of vulnerable people who use drugs are part of society. We are all connected. The virus knows no boundaries. It doesn't respect, what newspaper you read or what social and economic class you come from. It's going to affect everybody. And we're all interconnected, and we need to, and the solutions require us to be connected as well. And how we deal with the most vulnerable in society is going to be a key marker of our success in addressing the problems we're facing now.
And just because we're encouraging people to keep their physical distance for social solidarity, to take from your tweet today, doesn't mean that you're unable to help. It doesn't mean that you stop caring. Okay, look, are there any final words that you would like to share, other than we'd encourage people to leave their comments and share good things that are going on in the world?
I suppose the other piece that of work that we've been doing at Transform is, along with a bunch of other colleagues in the field, like Release and PRI and people, is the issue around prisons, because the prisons are obviously high risk populations for epidemic spread. They have a high population of people who have problems with histories of problematic drug use, and they're full of non-violent drug offenders. So there's also a big push to try and particularly the most vulnerable, pregnant women with children, people over 50 or 60 who are in prison. The prison system in the UK is horribly overstressed and overcrowded already. We really do need to relieve that pressure, especially given that there's 4,000 or so prison staff are already self-isolating, and COVID cases are already cropping up. We need to have some kind of managed release program to get those people out of prison, at least a significant number of them, so that we can reduce the pressure on the system. So people on remand, people on early release, people who are serving under 1 year sentences for non-violent offences. We certainly shouldn't be sending anybody to prison, let alone minor drug offenders at the moment. Yeah. That's another key part, because they are another key vulnerable population that we need to be mindful of at this time.
I mean, and I work in prisons, and I can tell you that a lot of people there at the moment probably do not want to be released, because they know that they're going to be, homeless. It'll be a long way for them to get their script, and bizarrely, they actually might feel safer in prison. And for anyone to choose to be in prison than to be free
shows how bad things are going.
Yeah, exactly.
Yeah. I mean, if obviously there are a lot of challenges with this, and if there are managed release programs, it's going to have to be done sensibly. We don't want COVID being taken out of prisons into the wider community. There's going to have to be testing and halfway houses. Obviously, we need housing and medication and support to be provided for those people. Otherwise, it could backfire. But it does feel to me like the prison population is a very important part of the discussion around vulnerability that needs to be had. And I think that could be another situation that is very likely to blow up in the next few days and weeks. And we need to be keeping an eye on it and some creative thinking. One of the things, crisis can create space for innovation and change, and change the way people think about a lot of these issues. And again, maybe something positive can come out of this tragedy, by forcing people to reevaluate some of the ways that we address vulnerability, particularly around people who use drugs. Sorry, I do actually, unfortunately, have coronavirus. It's sort of in recovery. I'm over the worst of it. It wasn't very nice.
Hopefully this video will go viral, and that's the only thing you'll be spreading, Steve. I would like to thank you for your time, particularly coming from your recent sickbed, and I'm really confident that this video recorded. So we'll get this up really soon. And if there's someone like you'd like to interview, please let me know. And if there's anyone watching and you think we should interview you, or you know someone who's got something interesting to say, then yeah, let us know.
Okay, the only thing I'd say is do follow the Transform Twitter feed for updates and information. We'll be sharing stuff that Transform and other organisations are doing. I'd also encourage people to follow IDPC's Twitter feed and Release and Talking Drugs Twitter feed, amongst others. We do need to keep that conversation going. We need to keep the information flowing. It's a really rapidly developing area with a lot of new experiences and information bubbling up every single day, and we need to be tapped in and sharing our knowledge and information to make sure that the responses that we do develop, both in terms of policy on the ground and in terms of advocacy for reform, are being shared between people. So let's keep talking.
We may come back to you in a month for an update, Steve, because as you said, we're still going to be in it.
All right, thanks a lot, Adam.
All right, take care, mate. Cheers, bye.
And so the question that you chose to ask, will it be better where we're going? And though the answer I don't know for a fact, still my heart is saying, oh yeah.
Still just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine. Yeah, I'll be fine. Yeah, no longer focused on yesterday, and I don't care, the rest will say whatever they want. What's left to say? What's left to say? Cause I'm leaving all the pain today.